Lumbar spinal stenosis is an abnormal narrowing of the spinal canal in the lower regions of the spine. This canal is a canal that your spinal cord and nerve roots live in. The narrowing caused by the spinal stenosis causes a restriction to the spinal canal, resulting in neurologic deficits, including symptoms of pain, numbness, tingling, and loss of motor control. The diagnosis of spinal stenosis involves an evaluation of the spine. The process begins with a medical history and physical examination. MRI scans are typically used to determine the extent and location of the nerve root compression. Treatment of lumbar spinal stenosis includes non-surgical and surgical treatments. The effectiveness of non-surgical treatments is unclear, and many times they are only of temporary benefit. These include medications to reduce inflammation, exercise, weight loss, physical therapy, and epidural steroid injections. Traditional surgery to treat lumbar spinal stenosis include lumbar decompressive laminectomy and fusion. This involves removing the roof of bone overlying the spinal canal and the thickened ligaments, and diffusion, which involves placing screws and bars in the spine in this area to stabilize the spine. While these surgeries have a reasonable success rate, they are major surgeries, often with prolonged hospital stays and long recovery times for the patient. These surgeries are destructive and irreversible and can cause other problems such as scar tissue in and around the spinal cord, as well as degeneration of the remaining lumbar discs, both of which can lead to chronic pain after surgery, which is very difficult to treat. A new surgical procedure has just been developed which can treat lumbar spinal stenosis with Band-Aid surgery, with the patient returning home the same day. The procedure is non-destructive, easily reversible, and does not require general anesthesia. It is called Superion and has recently been approved by the FDA. The success rate is comparable to the traditional surgeries, but no bone or ligament is removed, and no screws or bars are placed in the bone. The Superion procedure starts with a 1-inch incision through the skin, and then small dilators are used to place a port about the size of your little finger. All the surgery is done through this small finger-sized port. A small device is placed between the posterior processes of the spine. The posterior processes are the bones that you feel when you reach back to feel your spine. This device maintains height between the bones so nerves can exit freely